If you were speaking to a colleague who wanted to start off in ICL, or if somebody who's experienced already was wondering about introducing ICL Guru into their clinic, what do you think are the main upsides to investing in this extra bit of technology?
Look, today, if you're entering now into the clinic, you're competing with people who are doing this for a while already, who've built up a clinic with a reputation. They've made the mistakes and they're not making mistakes anymore. And today, with you starting a clinic, you don't have to repeat those mistakes. In fact, look at where you're starting with ICL Guru. You're going to avoid mistakes that everyone else of us who's been doing it for a while have made. And you're going to have a much tighter sizing spectrum than what we've had over time. So what I would say to anyone doing it, there'd be two things. How many of our colleagues have you seen who aren't really proficient with diffractive multifocal IOLs decide to do one, get a very bad outcome, unhappy patient? I just mean an unhappy patient, not necessarily a bad outcome, but an unhappy patient. They say, not doing it again. In the LASIK days, when we used to make a flap with a microkeratome, and I think the flap I'm making, or I'm hoping the flap I'm making is 30, and we used to start measuring. In 2000, we were measuring already, and the flap was in fact 200. Those kinds of surprises. I see ICL in exactly the same space. I see ICL Guru as giving us what femto LASIK gave us. It didn't necessarily give a better outcome in terms of uncorrected vision and best corrected vision, but it gave us this huge safety zone. We could treat people, more people were included now because we had a better safety zone. We knew the flap would be within 7 or 10 microns of what we're targeting. We know with Guru, we're going to be very close to what we're targeting. I personally, for today, can start doing it without having a UBM. There's no question about that. If you want to have the smoothest possible ride and the most positive experience of becoming a confident ICL surgeon, just do it right from the start. Why on earth would you first have a few cases you're sorry about, that you're unhappy that you did? Why would you have that before you invest in it? Why don't you just invest in it and avoid the problem altogether?
Here's an interesting way of thinking about it. This is the way that I would, if somebody asked me, should I get one? What I'd say is, think about it from the patient's point of view. If a patient knew everything about ICL surgery, would they ever go to a surgeon who's not doing UBM sizing? If there are two surgeons on the same road, same ICL, same numbers, and one does UBM sizing and the other one doesn't, and the patient knows the benefit, there's not a patient on the planet who won't go to UBM, using surgeon.
Brendan, that's a very good answer. You're 100% right. We do everything patient-centric, and that's a very patient-centric answer. You don't need to convince anyone. Exactly. The patient did the choice. They'd want the best information to make the decision.
Patients are getting more and more literate. Patients coming in, they know a lot about this. As ICL becomes more and more popular refractive surgery choice, people will know more about it. And I think if people look into it at all and they ask that question, it'll be difficult to defend not using it when it's a technology that's debatable. And as we've seen, we had never used UBM before. None of us had experience with UBM. Neither of us had experience with UBM. And within a week, we're using it to make decisions because the technology validates the scans for us. I think that takes so much of the hassle out of it. The fact that what I'm getting is a high quality scan and will give me an accurate outcome.
If you flip that question and say, would I be happy doing an ICL next week without the benefits of ICL Guru and Sonomed? My answer is no, I'm not doing it. I won't do it. I'd rather wait until we get the Guru. We're just not doing it now without that information. That's how crucial it's become.
Yeah, you forget what it was like without it.
Yeah, exactly. All right, I think we'll wrap it up there. I'd like to thank you all for listening. I'd like to thank Sonomed for the opportunity and Brendan for the discussion. It's been really good. I just want to say that neither Brendan or myself are consultants for Sonomed. We agree to do this because we absolutely believe in this and we want to share our experience and make ICL more predictable and safer for everyone. Brendan, your last thoughts as someone starting out on this journey?
So ICL surgery can be daunting. And I think that starting with this confidence and the confidence that what I'm doing is going to be safe for this patient is something that I don't think I would have jumped into as much as I had without this technology. So if anybody's thinking of starting an ICL, the first question they ask is, what do you do about sizing? And the only answer I have is get a sonomed and get ICL Guru.
Yeah, I think that's good advice. Well, thanks very much.
Thanks, that.